The next pledge, we go. I acknowledge that the special training I've received has prepared me as a responsible member of the community. I promise to take care of the sick with all the skill I possess, no matter what their race, creed, color, political or social status, sparing no effort to conserve life, alleviate pain, and promote health. I promise to respect at all times the dignity of the patient in my charge. I promise to hold in confidence all personal information entrusted to me. I promise to keep my knowledge and skills at the professional level and to give the highest standard of nursing care to my patients. I promise to carry out intelligently and loyally medical instructions given to me. I promise that my personal life shall at all times bring credit to my profession. I promise to share in the responsibility of other professions and citizens for promotion held locally, nationally, and internationally. So help me God. Thank you. Please be seated. Would call on the chairperson.
Has put together concerns and challenges, problems that have been experienced by nurses within the country and some outside. And so at this point, permit me to share with you some of these concerns and the message that the President wants us to hear. In other words, wants us to listen to going on like this. International Nurses Day is a special day observed around the world on 12th of May of every year, the birthday of Florence Nightingale, to celebrate the contributions that nurses make to society. This annual event was initiated in 1965 through the efforts of International Council of Nurses, and in 1974, 12 May, the birthday of Florence Nightingale was chosen as the day to celebrate nurses. The Ghana Registered Nurses and Midwives Association, since its inception in 1960, has launched every International Nurses Day and followed it up with Nurses and Midwives Week celebration in the 10 administrative regions of the association. At 64 years, this past March 20th, the GRNMA, as the holder of the collective bargaining certificate of nurses and midwives, has presented the interests of the workforce over the years. Nurses and midwives are the single largest health workforce in Ghana, forming up to 70% of the total workforce. That is why the Director General of Ghana Health Service calls us majority leader. Indeed, our sheer numbers will contribute significantly to the healthcare delivery of the economy of Ghana. Despite this, governments have failed to make necessary investments and policy choices that will ensure the physical, mental, and social well-being of our professionals. This has a debilitating effect on nursing and midwifery workforce and equally undermines the possibility of safeguarding a healthy and a better future for humankind. This address will look at 8 thematic areas, issues of concern and importance to the nurse. The first one we'll discuss or we'll talk about global shortage of nurses. There's a global shortage of about 6 million nurses, according to the ICN report. 89% of these are in low and middle income countries. The nursing workforce is understaffed, leaving the available nurses overworked. This leads to high rate of burnout and makes the nursing profession unattractive to young people. The story in Ghana is quite different. Despite the low remuneration, there are many challenging issues confronting the profession, it is still very attractive to the youth of Ghana, with many missing out on getting admitted to their preferred colleges to be trained as nurses. Thousands, especially the year 2020 and 2021 batches, remain unemployed, and this is a great source of concern for us as their skills contribute to deplete day in and day out. Several engagements with the Ministry of Health and Finance indicates financial clearance being issued in the nearest future. So we are still keeping our fingers crossed and waiting for the issuance of these financial clearance to be able to look at our friends, loved ones who have been trained since 2020 and 2021. The next matter is nursing education. There is that urgent need to implement a degree qualification as entry into the nursing and midwifery profession by upgrading all nursing and midwifery training colleges in the country to degree awarding institutions to strengthen the nursing and midwifery workforce and ensure the right set of skills for practice at all levels. The GRNMA has consistently advocated for this, and it is premised on the need for Ghana to have highly skilled nurses and midwives taking care of Ghanaian population and also being better placed as a country to export them. Still, on nursing and midwifery education, we need a befitting structure for Ghana College of Nurses and Midwives to enable the more nurses and midwives to be trained as specialists. On COVID-19 and lessons thereof. The COVID-19 pandemic exacerbated pre-existing and rising shortage of essential medicines, vaccines, and anesthetics, and generated shortage of medical devices such as face masks and respirators. The vulnerabilities of the supply chain of medicines and medical devices were very clear. Analyzing policy options to anticipate and mitigate shortage risk and highlighting the need for international cooperation and coordination among governments and collaborations with private sector cannot be overemphasized. During the pandemic, nurses were on the front line of the global response, delivering hope to their patients and their families, a demonstration that nursing care has an economic impact that is a way beyond the value that governments have placed on it. Real and sustained investment in nurses and the health workforce requires commitment that must be written into the heart of the post-pandemic treaty that world leaders are now negotiating. We need a deeper consensus on how to protect nurses and midwives in any future pandemic, and we hope that the pandemic treaty, which is in its final phase, will ensure the protection of health workers' physical, mental well-being, and in any future pandemic. On the issue of migration, in today's world, at least 1 out of 8 nurses practices in a country other than the one where they were born or trained to become a nurse or midwife. Several of those who migrated through recruitment agencies face super exploitations and demoralizing conditions. The recent CGNFS Economics of Nurses Migration report cites 3 main reasons why nurses migrate to the United States. 1/3 said they were following their families and other loved ones. Another 1/3 cited economy, to lift their families out of poverty, and the remaining 1/3 said they had migrated for professional and career development and advancement. These reasons are not different from the data gathered by the GRNMA and its partners in a study as far back as 2010, or what the Nursing and Midwifery Council also gathered in its recent study on nurse and midwife migration in Ghana. We need to have better remuneration and other enhanced conditions of service. Therefore, nurse migration, if not ethically and transparently, offers nurses opportunity to improve their own life, their careers, their family lives, and their communities, wherever they decide to live and work, as well as if when they decide to return to their country. The next round of development of a global state of nursing and midwifery is being developed by the WHO in partnership with the ICN and the ICM. It provides a clear picture of the world's nurses and wish to let the Ministry of Health and its agencies know that we are available to assist in producing the report on Ghana. The issue of pension remains still a challenge to the professionals who have served their country over the years when they are going on retirement. It is an undeniable fact that our country faces significant challenges. As participants in the recent DDEP, we have invested a substantial portion of our future retirement funds through our Tier 2 scheme and our GRNMA fund, which is a model Tier 3 scheme. We are banking on the government's swift recovery effort and urging you to ensure that all this economic revitalization, fostering growth of business and enhancing general livelihood. I'm sure we have heard a lot about this Act 766, the unification of pensions that Act 766 as amended sought to bring not materialized, and it is disheartening that those who do not even contribute financially to their pensions rather receive huge sum lump benefits and monthly pensions after retirement under Cap 30. Unification of pensions must happen in Ghana to ensure equity and decent retirement at all levels in the profession. On the issue of COS and GRNMA negotiation, every day in the life of a nurse or midwife is a day for caring for others, but not for ourselves. It is about time we get these decision makers to ensure that we are cared for and cared for well. The process hasn't been that smooth, although it has been very tough getting the employer team to take on any allowances. What we need at this time is for negotiation to be concluded to ensure that whatever that nurses are demanding in the country becomes materialized. Friends here gathered this morning, I'm sure we have heard some information about our COS. And the fact that teaming nurses in this country are not happy, a lot of nurses are not happy with the condition of service. And I think it's one of the reasons why Madam President wants us to understand that it is not something that the association kept quiet and was not ready to negotiate. The association put its best foot forward. But due to economic challenges, government also said they were not going to take on any other allowances. That is why we are seeing what we are seeing as the condition of service that we have signed to it. Talking about our conditions, we cannot leave our rotation nurses who completed their mandatory national service and have not received a penny as their allowance. Our young colleagues in training are also waiting for their training allowances, and our unemployed nurses are also waiting to be employed. Still on the condition of service, there is the need for Cabinet to approve rural incentive package developed by the Ministry of Health with the support from the WHO to attract and retain health professionals, especially nurses and midwives in rural, deprived, and underserved parts of the country. We also need the reinstitution of the vehicle tax waiver for health professionals and ensuring that the major unions within the health sector, like GRNMA, play a significant role in its administration to prevent the abuse of this package. There are issues of concern when it comes to workplace violence or harassment. Nurses and midwives across the world continue to face violence in the workplace. While not much data is available on this subject locally, it is an important issue that has to be talked about. Ladies and gentlemen here, we wish to use the occasion to call on government to also ratify the Violence and then Harassment Convention 2019, commonly referred to as the C-190. Among other things, the C-190 acknowledges the violence and harassment in the world of work affects a person's psychological, physical, sexual health, dignity, and family and social environment, and further recognizes that violence and harassment also affect the quality of public and private services and may prevent persons, particularly women, from assessing, remaining, and advancing in labor market, and that gender-based violence and harassment disproportionately affect women and girls. Additionally, the C190 recognizes an inclusion, integrated, and gender-responsive approach which tackles underlying causes and risk factors, including gender stereotypes, multiple and intersecting forms of discrimination, and unequal gender-based power relation, is essential to ending violence and harassment in the world of work. In a collaborative effort, the Women's Committee of NAT and GRNMA have already paid a visit to Parliament on this matter. Organized labor called for this at this year's May Day celebration, and we hope and pray that the C190, which addresses work-based violence, will soon be ratified to protect not only women and girls, but our men and boys as well. On the upcoming election, the last time Madam President checked, Ghana and its 34 million and over population, including all of us seated in this hall and those watching or those who have joined online, Ghana, our beloved nation, it is our individual and collective responsibility to ensure protection of our peace before, during, and after the December elections. Whether it's about breaking the 8 or running a 24-hour economy, the peace of our nation and human security should remain paramount. We as an association humbly call on all political parties and their leaders and followers and the general citizenry to put Ghana first in all times and ensure that our peace and democracy is protected. During this year's May Day Forum, we had an electoral commission, the National Peace Council, and the IGP assuring us that our December national election will be free, fair, and transparent, and that our security will not be compromised in any shape or form, and that all parties have committed to this peace pact. We have also witnessed what has happened in other countries in the African region, and we do not want same for Ghana, our motherland. We are therefore calling for peace to enable us continue taking care of all Ghanaians. To conclude, I wish to reiterate the need for our country to focus on the enormous potential that strategic investment in nursing can have in generating economic and social progress, considering that 59% of the global health and care workforce, up to about 70% of Ghanaian health workforce, comprises the nursing and midwifery profession workforce, and thus occupies a critical role in the effort to realize the universal health coverage and achievement of sustainable development goals. I wish to take this opportunity to celebrate nurses for their hard work, dedication, and sacrifice across Ghana, from CHIPS compounds to the teaching hospitals, to our nurse educators, preventive health care nurses, clinical care nurses, and our researchers. Your contribution to Ghanaian economy cannot be overemphasized. Let us, with one voice, demand investment in nursing and midwifery to ensure adequate numbers of well-trained and well-paid nurses. Labor and trade unions right for nursing and midwifery unions. Zero tolerance for violence in the health sector. Ensure that when nurse migration takes place, they are on fair and ethical grounds. We wish to assure all stakeholders that the GRNMA is well positioned to partner you all on issues related to health, with a vision of building resilient health systems, improving health services, and developing a well-motivated nursing and midwifery workforce. Long live GRNMA. Long live trade union solidarity. Long live Ghana. Thank you.
Thank you, thank you. Thank you, First Vice Chairperson. At this point, please, we can look at the back of our program outline. We'll see the Nurses Pledge. With all humility, we could all be upstanding to recite the Nurses Pledge.
Apam, Gomorrah's district. I think my question, it's one question, but to go for both presented. I think, Father, it's a wonderful presentation you've given us. My question is, I've noticed in all your deliveries, both of you said that there's a need for the nurse to be upgraded. I mean, to continue upgrading ourselves in knowledge. But I think, I don't know why it is difficult for nurses to be allowed to further the education in this era of sandwich, so many free ways of, having yourself upgraded without being necessarily bonded for 3 years, 5 years, and all those stress that people go through. I want to know from you, why is it so that managers, sometimes it is difficult for you to allow nurses to upgrade. Then I want to go to Father. I'm in a CHAC facility, Catholic Health facility. And so I want to find out, what is the church who own these institutions? What are you doing regarding the kind of injustice that staff go through in hospitals that we deem it to be a church or mission facility that should also uphold certain standards of Jesus Christ? What is the church also doing in that regard? Thank you very much.
Joseph Nimakon from KE. Please, my question goes to Mr. Thomas. Sir, please, if you can hear me out. In some hospitals or some polyclinics, you can imagine a nurse to a patient ratio. Sometimes 2 nurses on duty, then you can count like 50 patients. So if 2 nurses are taking care of 2 patients, you can imagine what will happen. And these patients who will be complaining, some of them will be saying, I was here around 1:30 p.m. Somebody just came and you have sought him or her out. So it is really a headache for some of us. So if anything happened, then you will be held responsible. Then I think something must be done on it. And my second question too is like, if the doctors are not around and a patient come with an emergency, you being the nurse, you want to help with the knowledge and skills that you have acquired. Then if anything happens, you'll be held responsible. So in that case, are they trying to tell us that if they come, we should sit and watch them, so that when the doctors come, they will come and write in the folder and we also proceed? Thank you.
Presenters, the name is still Papayao, Cape Coast Teaching Hospital Chair. My question is about the purging the nursing education at the first degree level. It has come up in so many writers, so many talks, so many sections. What is the way forward? It has been years now, it has been talked about. I remember when I was leaving NTC, I was told very soon all NTC will go first degree. It has been long oversaid. What is the process? What is the way forward to go through? Because study leaves and this is that usually we talk about. When we are all at the same level, these problems like this one will go to school in the next 3 years, in the next 5 years, would have been minimized. What is the process? What are we supposed to do? What is the way forward? Thank you.
Martin South. And please, I want to know, doctor was saying with the shift swapping, maybe you are the only person on duty, and then you get to know that that day might be a heavy day, which maybe your strength won't allow you. And then you think maybe weekends will be okay for you. And then you swap with a friend or a colleague. Please, is that okay?
Thank you very much, presenters. I'm Julius, Chair. My question has to do with why are we always considered as arrogant, especially the male in the profession, when you tend to speak out something that you seem not to? Because personally, when I was at the NCC, I was the student leader, and I had so many tribulations from my management. Sometimes even when JMTA sends us a letter to serve to our Dean of Students, they will tell you that because you didn't do 1 or 2 things right, we won't acknowledge this. So we were deprived of going for Congress and other things that could help our colleague students. And here in this case, you've come into the profession again and you realize that when something is seen which is not right, you speak about, then you are either intimidated by saying that because of this action that you portrayed, you can't be given a chance to perhaps maybe go for these workshops, or you'll be denied a steady leave. So, I mean, most of us here are seniors to me, so I kind of want to throw this question to us and we deliberate how we can stop this, because it is killing the profession, frankly speaking. I don't know whether if it is because it is a female-dominated profession. That is why when women assume certain positions, or some men assume positions, they always want to intimidate others below. Thank you.
Every institution, whether it's a mission or a secular, you have injustice. Whether it's a secular institution or mission institution, you would meet this canker of injustice. But then, because it is a religious institution, we all presuppose that something good should come out of the place. What I've realized is that in the religious institutions, it's not necessarily the church, but those who are there. Some are church members, and some are even not church members. They are rather killing the system. And you hardly hear of these things. One, is that the members in the institution who are going through this injustice have refused to talk. They are quiet. And you know that anytime you pass through, those who are into clinical health and others, anytime you pass through any stage, 3 times, you become the same person. And so you, the person suffering the injustice, crying here and there, you'll be made the next administrator, and the same thing, because you didn't talk about it. The church is there. Here, I'm not speaking for them, because if I want to speak for the church, I need the permission from the Archbishop. But then I'm saying it as maybe as a professional, that we need to talk. When you see bad, talk about it. Go to the necessary authorities and speak about that. If it is not working, walk to our secretariat. This is what I have seen. This is what is happening here. I think this year, beginning of this year, around January or so, I went to Apam Hospital and I met the management for retreat. I told them the same thing. And even among them, they had the same challenge. So where is it coming from? It's because good people are not talking. And so bad people think that they are in charge. Let us begin to talk. Not only in the mission hospitals, even in secular ones, government hospitals and co. When we see things which are not just, let's talk about that. Anyone who talks about injustice and fears the consequences is not a man or a woman. Because you want to talk, but you don't want to be victimized. No. Who is a hero? As I finish right now. Let's say that all of us gathered here, we are going to search for water. And we decide to use Abra Road. So as we were going, I decided to use this side to maybe, I don't know, Ipoli campus, Cape Coast Technical University campus. As I tend to go to that direction, all of you will begin to say, hey, get back. Now when I hear sign waiting, we be sign waiting. Would you able to do? My brother was saying something like that. Would you able to do? Sign out here, or Yakolaboni, he doesn't respect, he doesn't. Now, if you don't mind them and you proceed, maybe you will discover water. And as soon as you see water and you shout, I have found water, everybody will come and they will lift you. Hey, hey. So if you want to be a hero, if you want to fight any system, then you shouldn't be someone who is coward, who wouldn't want others to talk about you, who wouldn't want to be victimized, because you need to be crushed. Then after crushing you, you come out victorious. So don't fear to talk about the injustice.
You can only have a way around it. We have sandwich programs that you can do. And that one, so wherever you find yourself, you and your management, you should be in good terms. You need to be in good terms. Some of the things, it might not be your turn, but I mean, you can lobby around. See, sometimes when you go to a place, get yourself closer to the big people. Do the donkey work. Anything that people are running away, you go and do it. Oh, director, what can I do for you? You know the spoil job. Oh. Yes, a master, every day. It doesn't spoil anything. Do the donkey work that everybody's running away. Don't be the type that when you're supposed to be at work, you are not found there. Because you have to be recommended. You need somebody to mention that, oh, Mr. Kofi is doing very well at the emergency. This guy, the OPD, is very good. And those are the small things that will push you forward. For the steady leave issue, it's a government policy. They will give you a quota. This number of people will go. But outside the quota for normal steady leave, you can also do the sandwich. UCC, most of the universities these days, they do sandwich programs. Sunyane, Kumasi, Accra, most of them, they do sandwich programs. So the steady leave issue is becoming difficult, but you have to also play your cards well. If you do well in the district, you sacrifice a lot of time and so many things for the place. When it comes to steady leave, they'll look at you first. Is that not it? Yeah. There are 5 nurses there, and all the 5 of you cannot go. It can be either by age, those who were there earlier, or by hard work. And for hard work, don't assume that people don't like you. Please do your work genuinely, and they will pick you up. It cannot be that all the management in the hospital, they don't like you. How? What have you done to them? They don't like you. So please, the doors are not too close. Nurses are also moving forward. Bono Iso, whoever, the deputy director of clinical care is a nurse. There are nurses that have big positions in all over the place. So for education, there is a route. The sky is the limit. You can go anywhere you want to go to. So don't sit there and keep. No, the complaint sometimes is not the best. It's just like you're complaining that there are no jobs. When the job is also available, your qualifications are also not there. So how will you get that job? So please, for the school, let's try our best and go. Whichever way you have to go, do and go to school. Let's try and do it. My brother said there are only 2 nurses taking care of 50 or 100 patients. Please, let the management know that you're only 2 nurses and you're taking care of 100 or 50 patients. Do what you can do and leave the rest. Attend to those that are critically ill, those that are emergencies. Do those ones. For the complaining, the people complain. No matter what you do, people will always complain. Do you know that? You can't satisfy human beings. No matter what they do. No matter what they do. The executives, if they decide to share money here and they say, oh, everybody take 500, some people still complain. Is that not it? Someone say, oh, the 500 is too small. They were expecting 1,000, and I want my 500. If you don't give anything to her, they will complain. So do what they think you can do and leave the rest. Okay? So attend to cases that are quite critical. Those that are, if you don't do anything about them, they can die. So attend to those ones and leave the rest. Doctors not around. We are professionals. After diploma, you know some basic things that you can do. If somebody comes with diarrhea and vomiting, you don't need to wait for a doctor. Give your ringers. After the ringers, you add what? This will say line. Give the ORS. Those basic things, and call the doctor that, please, a case has come, diarrhea and vomiting, this is what I've done. Somebody come, the person is in pain. Your diagnosis can be given. Some places, the policy allows that. From where I come from, if you go to emergency, they don't need a doctor to do so many things for you. They do most of the basic things, give you an infusion, give you an injection. Then when the doctor is around, they tell you, this is what I did. And the doctor copies what you have done into the system. They copy into the DIMS, or what you call it, no, not DIMS, the LIMS. What we have there is different. You copy into the system, and that's all. We have PHIS. You copy into the system, and that's all. You go for the medications and as replacement, because that one you give it from your stock. Yeah, so all the time, make sure they have something down at the emergency or OPD where you're supposed to give treatment. So that once the emergency comes, you can do something immediately. Then when the doctor comes, oh, I did this and this and the 3 or 4 items that I did. The doctor will write, he'll even be grateful because you did the work for him. When the patient recovers, the credit will come toward the doctor. Meanwhile, the first care that you took was from a nurse. Without that drip, maybe you have died of dehydration. So please, let's not say we are waiting for doctors. What you can do, let's do to save life. Imagine the doctor doesn't come the whole day. Or is decided to behave like the 4 o'clock people. The Tema General Hospital people. Somebody leaving at 4 a.m., the other one is coming at 10. So please, what we can do, let's do with our knowledge that we have learned. Degree nurses, the way forward. So the degree nurses, they said it's supposed to be the first, the first degree is supposed to be the starting point. That one is a political issue. The enrolled nurses, they will continue to take them. Whether me and you will like it or not, they will continue to do it. Politicians, they want votes. And when they say they want to stop the program, they will make noise. So the first degree is fine. You can do your first degree, but for the enrolled nurses and other things, they will continue to mess us up. Whether you like it or not, it's a political issue. There's no way we will stop it. If the next people come in, they will do the same. If these people remain, they will continue to do it. They need votes. So there are certain things we are tight. Even our NTCs, look at how admissions are done. Are you with me. Look at how admissions are done. You can have the best of qualification and go there. Protocol list. More than the normal list. So where are we going to? The politicians control everything in this world. Or in Ghana, they control everything. So some of the things, there's nothing you can do about them. Then swapping with time. So if you are swapping, please inform your in charge. If you want to swap time, please inform your in charge. Your in charge is supposed to be somebody who knows more than any other person in the world. Or he's supposed to be somebody who is very experienced. So if you say you cannot come because you have a problem with your child or somebody, the in charge will look for somebody who is at least can be your match. Or if that's your colleague, that's okay. There's no problem about that. I don't like it when you, a senior nursing officer, you change time with an enrolled nurse. When you know very well that the enrolled nurse cannot do what you are supposed to do. That is what I don't like. But swapping time is good anyway, sometimes because of emergencies. But make sure your in charge is in the picture. For all you know, the in charge can be going around to check to see that all is well. We are doing this because we don't want problems. When the trouble comes, they'll call the in charge, call the medical soup, and all other people that matter. So let's take note of those things. Male nurses are arrogant. Arrogant is a negative word, though. The correct word to use is assertive. You want to talk about your rights. People should not cheat you. People should not stumble on you. But if you say you are arrogant, that means you don't respect. You are disrespectful, and that is negative. So if somebody tells you are arrogant, you find out from the person what does he mean. Okay? But I mean, it's so wrong to talk about things that you feel are not right. It's okay. Just be positive. Respect people and talk about it. If you think you are not well treated, you can tell the medical director or your matron, please, matron, I don't think this one is right. That's all. Don't disrespect it. Just inform, please, matron. I'm very fine with you. I like you anyway, but I think this one that you did, I'm not really happy about it. That's all. Very cool. You don't go and shout on your matron or go and shout on your in charge. Make your point and make it politely. Tell the person that you're not happy about the treatment, but not to use the word arrogant is a heavy one for me. If they say you are arrogant, that means it means a lot. So let's not attract some of those words to ourselves. I think I've basically done what I'm supposed to do, unless the next batch of questions that will come.
And Ewutu Senya East Secretary. I think my first question has to do with standards. I think standard actually led to most of the cases that went to court. But I'm trying to look at it from the other side. Because at the end of the day, the nurse has to do certain things, of which if the nurse doesn't do it at the right time, led to different things. But the question is, for example, a staff that use the chloroquine, knowing that the chloroquine is not even in the system. Our question is, chloroquine is not supposed to be used. It is no more in the system. What is it doing at the facility at that time? Now, and with these same standards, at times, I think it restricts most of us. It restricts. Because at times, there are things that you can do to actually save life. But because of certain conditions, knowing that there is no job security at the facility. Why am I saying this? At times, you may do certain things to save life. When problem occurs, they will tell you that what you did, is it actually in line with your job description? No. If it is no, there is no way the facility can support you. And with the nurses' migration, looking for greener pastures, at times, no matter what, you have to make that decision. Even though there are some people that, no matter the conditions, they will prefer to work in the country. But at times, when you look at the facility or the country you work in, or you work for, knowing that there are at times that the facility or the system can't support you in any way, then the question is, why then do you even die for your country or the facility? I remember some time back, I was using a government motor from work. I got arrested by the police, and trust me, when the case went to court, none of the facility members, no director, nobody even followed me to court. I went to court on 3 different occasions. None of the facility members or the directorate followed me to court. So I came back and asked myself, is this a system that we worked for, to actually sacrifice for? So at times, certain things that we do or some actions that we take, not by any not our fault, but we are compelled to do them. So I think these are the concerns that I have.
Cape Coast. My question is in relation to what Mr. Thomas made mention of nurses working within the scope of our practice. For instance, the facility that I'm working in right now, it is nurses that are prescribing. We call them prescribers. I want to ask, what are the measures put in place to protect us? And then, in as much as we are working against, we are not working in our scope of practice. What are the measures put in place to protect us? And as much as the Ghana Health Service is also using us in some way, because, for instance, when they go for the bargainings,
nurses being abused verbally and then physically. I work at a place where the youth there can do anything at any time. Now, what do I do if I see that the actions of patient relatives is going to harm me, whether verbally or physically? As for the physical, it is possible that if you even stand, you will be you would have a problem, or you may be hurt by their attitudes or by their actions. What do I do as a nurse taking care of patient at that particular time? Thank you.
EOUs. The law doesn't permit us to do those things. If you do circumcision and something happens, the law can take you on. If you do EOU and the law and something happens, you can take you on. You are not a midwife. Midwives are allowed to prescribe. Is that not what the law says? But a general nurses who are prescribing in that hospital, please talk to management about it. If they back you to do it, fine. If they don't back you, they know that you are doing something that when there's trouble, you will be found wanting. Why should you prescribe? There should be doctors to do that, or what do they call it? The physician assistant should be doing those things, but not nurses. The other day I heard a story about, I think that's in Fosu area, where the doctors will come and write on the paper and leave. Then the nurses have to enter it. No. Enter your thing with your password, so that if there's trouble, it's Dr. Mensah, not Nurse Grace. Enter it into the system. When there's trouble, they'll look for you. It's Dr. Mensah who entered or who gave those medications. Not that Dr. Mensah will come and write on the paper, then Nurse Grace will use her password to enter it. If there's trouble, then trouble goes to Grace, not the doctor. So please, let's do that. Then about the migration, for going, you can't stop anybody from going. Even the president of Ghana cannot stop us. We will go. There are some people who also no go, no matter what. If you even bring the plane to their village or their hospital, they'll say, please, I won't go. So that one is 50-50. Those who want to go, go. Those who want to go to her, who don't want to go to her, they won't go. But the sad aspect of your case is the motorbike. I don't know what happened. The police arrested you. Your management didn't come to your aid. That is wrong. If I'm you, I will look for a transfer and leave that place. It's not a healthy environment to live in. That you were going to do work for the place. You got into trouble with the law and the management. They should come. Even if you are wrong, still they should follow you. It's like your child. If your child goes out and misbehave, you still follow your child. Go and plead for mercy, and then when you go home, you can cane your child small. Next time, don't do what you did the latter day. It should have followed you. It's not right. That means the people who are heading your place, wrong with them. It's not right at all. It's not right. It's not normal. If you report this to the regional director, I'm sure he will take action. He will not be happy with them. It's not normal that you are in your course for your work. You get into trouble and no management member came to the court to even say that, oh, this is our staff. We are sorry for what happened. What can we do? No. They should have given you that support. If not, after the court case, as I said, I would have asked for transfer and leave. Even come to the region and tell the region that, please, director, I've done my best for this particular place. When I was in trouble, they didn't help me, so I'm leaving. And he would do it. The director will sign it for you to go. You don't accept some of those things. It's not right. You are being abused unnecessarily. Then scope of work. I think I've spoken about the scope of work. Then nurses being abused verbally and physically. Yeah, some communities, these things happen, but we need to engage the chiefs and opinion leaders in the place. You don't fight, you don't fight the people who take care of you. It's wrong. Anywhere in Ghana where the people have that mentality that you can always go and beat doctors, beat nurses, insult them and go free, it's wrong. We don't fight the people who take care of you. It doesn't happen. You don't fight the people who take care of your health. It doesn't happen anywhere. So please, let's talk to your management. They can have engagement with the community leaders, the chief, the assembly member, the MP. Let's talk to them. I mean, there should be some enlightened people there. We're in a civilized world, though, so I don't get it. Then you get up and go. What happens before they start insulting you or they start beating you?
I want to specifically talk about federal government hospital emergency unit. Know that when a patient or maybe if an emergency case is brought in the emergency unit, there are certain things that you have to do. The nurse, even or the emergency team, those at shift have to do. Whilst doing that, you know that it is one core thing that every patient should go, especially register for.
And becomes a moral law. You'll be happy and enjoy it. So there's no, we may have a traumatically passive environment where those there because of traumatic issues. I've been at Swedro for 4 years. I work there. I know some of the community members and those around, and the Gomoa town surrounding Swedro, how they can also be. But one thing I know that if you go there also with love and maybe a change of perception, by the time you went there, the one living told you, I had your money giddy. So you also experience giddy and you want to be giddy, just go down. When they come and it's like that, calm down. Don't mind them. Then you see that when you are not minding them and you are working, you'll be able to divide the group. You'll be able to divide them. They are already aggressive. Don't go there with aggression. That is why you are a professional. A professional is someone who is able to do things at the right time. So don't just meet them eye to eye on that. As our speaker said, see that you may use the appropriate quarters. I know the chiefs and assemblymen and others, they will speak to them. And I know that some young men in the community, they are their ring leaders. Contact them, use them, and you'll be able to get this aggression going down. Imagine by the time you leave there, or Budumbruam, and through your research, through your learning, through your engagement, community engagement, you have been able to reduce this aggression to the minimum level. How happy will you be wherever you find yourself? Hey, it's a good thing for you. Take it as a research, but remember that all those who come to our clinics, they are all having their traumatic issues. They come with aggression. They come with unresolved emotional issues. And that when you go there and you don't tackle it well, and you are saying, is it possible? There's this sister, Reverend Sister, those working that in Tibetan, sorry. They brought her sister, first sister there, no one. Almost on I think, oh, yeah. And they brought her brother too. So such a person, you think, say, obey me, I calm. No. He will just be going around. Oh, it's because of something. Let us take care of our patients so that when we are patient with them, when we understand their issues, at the end, they will bring Brodier and you to say thank you. God bless all of you. Thank you.
Thank you. Time is fast spent. I want to appreciate all our presenters. And a lot from what our president, Perpetual, sent. She talked about greener pastures. And from Uncle T about standards, we learned from our keynote speaker. He talked about seed sowing and other things. I just want to add a little voice, analyzing all that they talked about. Attending to greener pastures. I think last year there was a program here, I talked something about it. I was encouraging all of us that let's prioritize staying home. For me, I love Africa. If not for anything, I love our sun, the sunshine. Hello? I nearly spoke Fanti right now. And Senkawara Oroko Minnesota na award to You are being treated like a vaccine or less than a vaccine. Vaccines are kept in temperatures of +2 to +8, right? And just imagine a human being in a temperature in negative temperature. And I told you that some of my colleagues there, they have metals in their legs and their hands because the cold has broken the hand, the bone in the hand and the legs, right? But then they will dress in a sophisticated manner and be over Facebook and you think that they've got good life. Of course, there's a positive aspect. For example, last year when I went to the States, I worked for $30 per hour. I have been privileged to have the opportunity to get a registered nurse's salary, right? And when you look at how, if you go for 12 hours, I was checking it. If I go for 12 hours a day and I bring it in CDs, one day I will be making 5,760. Yes. And if I put it in dollars, I'll be making $360 per day. Hello? So, and then look at, for them, petrol per gallon is $3.5 some states. The highest it will go will be $4. Meanwhile, we with our small money, we are paying the equivalent of almost $7, $6 to $6 per gallon. Can you imagine? The person whose salary is more than perhaps almost 50 times mine, I'm looking at it per day, or by any criteria you multiply it by. You get me? So when you look at that, you just want to go. But, hello, life is not all money. Life is not all money. People have traveled for greener pastures, either with their children or without their children, and their children went wayward. Their children went on drugs. You see, I'm trying to balance it. I told you there's money, right? But then, life is not all money. A lot of people travel and they come and their children have been plagued with all kinds of things. Or their children, they took there. So travel when you feel led. Okay, and then the seed. In our practice, hello? Okoti and all our presenters talked a lot. Sometimes you see a nurse, her bag is a pharmacy. Doing business, she's not interested in the work. Sometimes a patient is discharged and some of the drugs are left. The nurse will keep it and sell it to another patient. That money you are getting, you pay for it in multiples. You are sowing a seed. Sometimes you may be a preventive nurse. They are telling you the vaccines are for free. And you tell the mother that, you know what, we didn't have syringes. I use my money, so everybody pay 10 cedis or 5 cedis. That money, if you are not careful, you will develop a condition that you will pay multiple in the hospital. Because when you put one corn in the soil, you will not just get one corn. You will get more. So when you sow a good seed, you get multiples in good results. When you sow a bad seed, you get multiples in bad results. I have a lot of examples that I could tell you, but please, let's be professional, let's be honest. And then I want to say that nurses today, irrespective of the fact that we are in a technological age, during our time when we were in nursing over 30 years ago, when we started nursing, you can only get information apart from what the teacher tells you in the class if you go to the libraries. And usually the libraries were located at dangerous places that you couldn't go certain hours. And before you get a book to take home, it wasn't easy. Musukana, that book is missing. You will pay heavy. But these days we have smartphones right in our hands. I learned the definition of health since 1988. It is still with me. These days, nurses come for internship and you ask them, what is health? And none of them can define it according to who. Tell me. Talked about standards. Let's maintain the standards. And because of time, let me give this last thing I want to say. Nurses, let's unite. Sometimes you find out in the district, especially the directorate, nurses will have issues, they will not take it to the nurse manager. They will go and take it to, yes, we talk about teamwork, but you should know your channel of communication. Okay? You see a nurse going to take something strictly nursing and even paying reverence to other units and leaving her nursing hierarchy. Sometimes a nurse is a district director and you see nurses persecuting that nurse. You do that, you are only telling people you are not the nursing fraternity is not capable of holding leadership roles. We have, like we heard, perhaps even in Cape Coast, for example, the nurses are more than 90% of the health staff. So we should carry the voice, but we are rather persecuting our own. I hope from now on it will be different. When we see a senior nurse coming, it shouldn't be a problem for us to stand up and everybody know that we are showing reverence to our leadership. Thank you, and God bless us all.